Assalamualaikum warahmatullahi wabarakatuh. Good evening, everyone. Welcome to join our webinar today, the SDG 17 Partnership for the Goal and Disability Inclusion. It's conducted under the Professional Speech Communication course. So first of all, I would like to thank all of you to coming to join our webinar, and I'm glad to see you all here for our discussion today. So my name is Na Yuwen, and this is my partner Bai Yingzhi as a moderator today. So by the end of webinar, we will set the Q&A section. So if you have any question, you can put in the chat box, and we will conduct later. So let me share some brief about our topic first. So our topic is partnerships for the goal and the disability inclusion. So the part is SDG 17 from the development and sustainable goal from the United Nations. So the SDG 17 emphasizes the development, the cooperative relationship or partnership, and promoting the development of the people with a disability in society. And it's mentioned to help people with a disability get the benefit and rights in the society. So next, let's start to our question. Before the interview, let me introduce our honorable guest, Dr. Rosita Muhammad Amin. So welcome, Doctor. So I will share my screen for introduction our guest. Second. Can you see that? Is it opening?
Yes, already.
Oh, okay. Thank you. So our guest, Dr. Rosita Muhammad Amin, is a professor of Department of Economics in IIUM. Also, she is a head of the Disability Survey Unit in IIUM. Our guest is her research interests include disability study, social economics, development economics, economy integration, and economic theory from the Islamic perspective. Also, she conduct the research project include understanding national implementation of the UNCRPD in Malaysia, the two-phase mixed method approach, and also she got the study on employment opportunity for persons with a disability in Malaysia. Also, our guest was present with a special award for the persons with a disability in conjunction with the International Persons with Disability Day by the Ministry of Women, Family and Community Development Malaysia for the year 2020. And also she was a member of the National Council of the Persons with a Disability. She was appointed as a co-chairman of the Committee on University Design and the Built Environment of the National Council of the Persons with a Disability. And sorry, I may let someone in first. Okay, so let's continue. And also, she was also involved as a member of the working group on accessibility for persons with a disability under the engineering central management and consulting survey section, Central Research and Management Center, the SIRIM Berhan. Sorry. So she was appointed as a member also of the Nation Education Advisory Council, Ministry of Education for the term 2018 to 2020. Tasked to look into the disability inclusion at all levels of education. So we can see that Dr. Rosita has appointed many organizations and positions. So she's the head of the disability unit and professor in the economy. So welcome our guest, Dr. Rosita Muhammad Amin. Assalamualaikum warahmatullahi wabarakatuh, Madam again. So we start the question. So first question is, what motivates you to help people with disabilities?
Okay, thank you very much, Sister Nayuin and Sister Bayunzi, for inviting me for this webinar. I think this is a very important topic that we need to discuss and address. Before I answer the question, because this is a webinar and we do not see in person, so I'm not too sure whether you have met me in person, right? So if for those of you who have not seen me, I'm actually also a person with disability, right? I use a motorized wheelchair to move around, so you cannot really see it in the screen. So I have to explain it, all right? So I've always been a person with disability. I was born healthy, but I got polio at the age of 1. So it affected my neural system and it causes paralysis. So I was not able to walk ever since then. Okay. So at the moment now I'm using I used to be able to walk with crutches and leg braces, but as age catches on, right? So the doctor no longer allows me to walk. So I'm totally on motorized wheelchair now. Okay. So that's the context in which I would like to address the question. Okay. You ask me what motivates me, all right? So basically, it's actually based on my own experience as a person with disability, right? And also my aspirations in terms of what I would like to see in this country and in the university, and also what are the realities that we have actually at the moment, right? So based on my experience, it wasn't an easy experience, and it was not an easy experience for my parents and family as well. And this is the same thing also. The same goes for all families with children with disabilities, right? So access to education is difficult, right? So in fact, my mother actually had to accompany me throughout all the time in school when I was schooling. There was only one school who wanted to accept me for schooling, but on condition that my mother has to stay the whole time I'm in school. It's very difficult to go to the toilet. It's very difficult to go to the canteen. I cannot join the other students, for games and so on, right? But Alhamdulillah, I did quite well in academically, right? But in the process, you can see how difficult the hardship that my parents and other parents had to go through, right? And I also know, what it takes and what what are the hardships of a person with a disability, the emotional, what do you call it, vulnerabilities, right? So the sense of insecurity, when you are not able to walk, so you feel very, very vulnerable, all these issues, you're not able to go everywhere, there are always barriers even though you're using a wheelchair, right? So you cannot go to all the places, right? Because not all places are accessible, right? unfortunately, in Malaysia, still many places are not accessible. Even in our own campus, some places are still not accessible. All right, unfortunately, because of the way buildings are constructed when it was built, there was no legislation regarding, there's no law regarding, compliance to certain standards with regard to persons with disabilities needs. Okay, to meet the needs of persons with disabilities. So in Malaysia there are 7 categories. I mean, it is persons with disabilities are categorized into 7 categories. Okay, different countries have got different categorization. Some countries do not categorize. Okay, but Malaysia, because we register the person with disabilities, so they put it into 7 categories. Okay, so physically disabled, okay, like me. Okay, and you have visually disabled, hearing disability, all right, and then you have also learning disability like dyslexia, like autism, right, falls into that category. And then you also have speech disability, all right, you also have mental or psychosocial disability, and you may also have multiple disability, the 7th one. Multiple means you may have more than one disability, all right. Because of the various different types of disabilities, the needs are also very, very different. All right. So as for me, more of a physical barrier is a problem for me. But for persons with vision impairment, who cannot see, who's a blind person, or a person who is deaf cannot hear. All right. So the problems that they face is different because they can walk, right? They can walk. So physical barriers is not an issue, but they cannot hear and they cannot see. So what are the barriers for them? The barriers is actually information barriers, right? So they cannot get full access to information. For instance, books, which are not accessible, not in braille, okay, or even if with technology now, you know that the blind can now read, with technology, computer, can read out loud, text which are in soft copies, they can read out. They call it a screen reader, okay, screen reader. But some books are not in the format that can be read by the technology, okay. So similarly with those with hearing impairment, if you don't have sign language, like what we have now, we have a lot of issues, discussions, but it is not accessible to the deaf. They do not know what we are talking about, they cannot hear, right? So it's issues like that which are faced by different people with different types of disabilities, face different issues. Okay, so it's different when I was studying abroad. Okay, when I was studying abroad, in investing in developed countries, they are more developed in terms of providing the facilities, right? So they have best practices over there. Okay, so buildings are accessible, university schools are accessible, all right. Even more materials are available in accessible formats, all right. So in a sense, when people with disabilities are abroad, okay, when I was studying in the United States, okay, I don't feel like I am disabled. Okay, I don't feel that I'm disabled. I can do whatever thing that other people can do. I can go to the shops, I can go to the schools, right? So it makes you have you don't you become self-confidence. Your self-confidence is improved, right? So otherwise you would have low self-confidence, low self-esteem, because there's so many things that you cannot do. You are sort of like imprisoned, okay, like you're imprisoned in your own house, or in your own room, or in your own wheelchair. You cannot go anywhere, right? So because of that, people with disabilities tend to have very low self-esteem, right? So very low self-confidence and so on. So these are the things, why we have to actually sort of try to advocate for disability inclusion, because persons with disabilities have every right to enjoy and to participate in all activities, just like persons without disabilities. Okay, so and this is the reason why, and the realities that we see, there are a lot of room for improvement, a lot of changes that needs to be done, right? Because when you talk about changes, right, so you talk about barriers, okay, barriers. So this now I talk about physical barrier, right? Talk about information barriers. There are also what we call systemic barriers, right? Rules and regulations which are not flexible, for instance, right? So and also the fourth barrier is the biggest one, which is what we call the attitudinal barrier. Okay, attitudinal barrier. Attitude. People have got, wrong attitude towards person with disabilities. So they simply refuse, to allow person with disabilities to, to also participate alongside other in the society, for instance, right? So some people look down on persons with disabilities. Or you are disabled, so you cannot work, you cannot join our company, you are not able to work. No, even though you have a degree, sometimes that kind of discrimination still happens. All right. So these are the things, a lot of things that we need to work on. All right. So you need to break this attitudinal barrier in order to bring all the other barriers as well. Okay. And this is the main motivation why I'm getting more involved in this area.
Okay, thank you, Doctor, for your sharing your experience. So I think it's very useful for us to know the category of the disability, these persons with a disability. So I think I will proceed to next question is, could you please tell us the kind of help your organization provides to the persons with the disabilities?
Okay, basically when talk about the Disability Services Unit, right? Our unit was established in 2012. Yeah, basically, it is we established it because it's based on my experience as well. When I was in the US studying as a student, an international student over there, right? So every university there has got this Disability Services Unit, right? So even before I go there, I have been assisted by the university. So they give me information on where to get motorized wheelchair. They actually arrange for my accommodation, right, which is accessible. They make arrangements for my transportation, which are accessible. When I go to school, even if I take public transportation, they reimburse, the expenses, from the university's funds. So these are the things that we want to bring to IUM, all right, and to other universities in Malaysia as well. So that's the thing that we do. We provide support to students as well as staff with disabilities. We also have staff with disabilities, about 14 of staff, 15 actually, staff with disabilities in IIUM, but we have 85 students with disabilities now. 85 students with from all seven categories. All right. So and we know that before the DSU was established, the students had to actually, work for themselves in terms of trying to, if they have problems with accessibility, they themselves have to go to the various offices to, to help, to seek help, to get the universities to help them, and so on. So with the DSU in place, so we are the ones who will do the job for them. All right. So we make plans in order to how to ensure that we break the barriers, the 4 barriers that I mentioned just now. So we make plans and we actually implement initiatives in order to break the barriers. So in terms of physical barriers, we try to improve the accessibility of the university, right? Of course, we address the immediate issues first for students who sometimes they need to go to classes. If the classes are not accessible, then we address those immediate issues immediately, right? And of course, there are other short-term, medium-term initiatives as well. And then, and support, the academic support. We also work together with the development division for the projects that I mentioned earlier. We also work together with the kuliah, all the kuliahs and the deans, deputy deans, right, in order to provide academic support for the students. So students with who are vision impaired, for instance, right, they need extra time because those with low vision, for instance, even though they can still see, but they take a long time to read, okay, and they cannot read for a long time because it will cause them a headache because they are low vision, right? Because it's just like, if you wear glasses and you try to read without your glasses, try reading it for many hours. I think it gives us a headache, isn't it? Right. So same thing for them is even worse because no glasses can help them. All right. Even the maximum power cannot help them improve their vision. So they are stuck with that low vision and they cannot study for a long time. So even for examinations, they have to be given extra time. Sometimes for the blind students, sometimes we do have students who became blind when they are students in UIA, right? So in IIM, so they cannot they're not well versed to use the technology, right? So we have a reader for them, somebody to read out for them, all right, the questions, and also somebody to write the answers for them, all right? So things like that, we provide support. We advise the kuliah to provide support for them. So we provide the advice. We work together with the kuliah and also at the units in the university. For Mahala, for instance, we make arrangements for them, all right? And then we actually also converted the Mahala Osman, the PG block, into accessible wheelchair accessible unit with attached bathroom. Okay, so there are 7 units with attached bathrooms that our brothers on wheelchairs can actually use. Okay, so it's easier for them. Even for the blind also, we allow we allow them to use the room because it's easier for them to go to the bathroom and so on. But the sisters we have not yet done. Okay, so there's still a lot of things to be done. Okay, and apart from that, assisting the students as well as staff. Or I forgot to tell that we also have mobility vans. Okay, to help students with wheelchairs. We have vans with hydraulic lifts. All right, so we help transport them to classes, especially if the classes are in KICT, for instance, which is it's on the hill. It's very difficult for them to go, or if they need to go to the hospital or elsewhere, we help them to go to the places, right? Apart from that, apart from helping students and staff, we also now moving into community engagement, right? Because the university is now moving into community engagement. So we are now having also a flagship, okay, where we also help the Orang Asli outside, Orang Asli project, and also have Islamic outreach project. We have Wacana Al-Quran discourse on TV, all right, on television. So it is aired on television and so on. So this is actually to improve advocacy and create empathy, all right, among the society and among the community in IIUM. Okay, yeah, there are a lot of things that we do. So this is
No,
some of them. Yeah. So you can actually go to our website and see the actual functions that we have. There are a whole list. I cannot be I think if I were to talk everything, it would take up the entire half an hour. Okay.
it's okay. So
All
thank
right.
you, madam, for sharing. I think it's very clear for us to understand the function of disability survey unit. So let's proceed to next question, and my friend will do the interview. Okay.
Okay, Assalamualaikum, madam. So right now, I will continue with our question. The first question I would like to ask, madam, is how does your organization collaborate with partners to help persons with disabilities, and how could they help your organization financially towards enhancing inclusion of PWDS?
Person with disabilities. Okay. So we have a lot of partnerships. Okay, ever since we were established in 2012, we work very closely with the ministries, government agencies. Yeah, Ministry of Women, of course, right, because I was a member of the National Council for Persons with Disabilities. They actually gave us a few fundings, okay, some fundings to organize programs. We actually organized a competition, a disability awareness competition, video competition, right? And we also launched our IIM Disability Endowment Fund. The minister herself actually also contributed to our fund, right? And then we also have worked closely with the Ministry of Human Resource and the Ministry of Education and Ministry of Higher Education, right? We also have government agencies like Genius Kurnia. Genius Kurnia is an early intervention facility. It is just situated in Sentul. So we work closely with them because we also have what we call special parents. Okay, special parents are IIM staff with children with disabilities. Right. So we have their children with autism and so on. So we work together with them, and sometimes they also assist us to deal with our students with autism. All right. And then we also have our Lembaga Zakat Selangor, our Zakat body. They have contributed a lot. Actually, they have contributed 2 mobility vans. Actually, 2 of our 3 mobility vans were contributed by Lembaga Zakat Selangor, Alhamdulillah. And we also have companies, contributing, like the Sahala Wuduk station at the mosque. If you notice at the sisters' side, right, there is a Wuduk station. So that's contributed by a company or a bank, I think, right? And also we have NGOs, right, which work together with us. When we have our IIM Disability Grant Awareness Campaign, we invited them, and they have always been very supportive of us. They come, and they also, MFT, for instance, the Malaysian Federation for the Deaf. We work together with them, and in fact, we have now offered 2 sign language courses for co-curricular classes for our students to take, right? So and they consistently offer the courses every semester. MFD is the one that conducts the courses. They also help us with the sign language interpreting in our official programs. Yeah, because we don't have our own sign language interpreters, and we also have people from Malaysian Association for the Blind, National Council for the Blind, right? So they help us in helping our students who are blind. Okay, so whenever we have students who have issues, we can contact them and they can actually assist. For students who are blind, for instance, they give what we call orientation. How they can get used to the new environment and so on. Okay, so the contributions are both in terms of monetary and non-monetary partnerships. Okay, in terms of the and we also have yayasan. We also work together with a lot of foundations. We have Yayasan Prihati, Yayasan Warisan Ummah Ikhlas, we have Yayasan Fakih. Yayasan Fakih works in terms of teaching um, uh, children with disabilities in reading the Quran. So many of our students, volunteers, have actually got trained by them, who will also be involved in our initiative to help children, little children, especially those with autism and so on, how to read the Quran. Okay, so it's very very fulfilling. And we also have companies, right, like Microsoft. They contributed to give awards. Okay, our the monetary reward for our students who graduated, right? And there are many other international bodies as well. We also work together with the International Institute for Disability and Public Policy in American University. We also work closely with University of Nottingham, and of course all local universities. We work closely together with them. Okay.
Okay, thank you, Madam, for let us know that it's a lot of people help with the disability unit. So my next question is: has your organization collaborate with the Malaysian government to include PWDS in society? Like, can you tell us a bit more, like Malaysian government?
Right. So I think I mentioned just now that we have
Yes, but
the
I
ministry.
would like
Yeah.
more.
So, but a little more of that. I think in relation to the flagship that I mentioned just now, especially the OKU for You project, we also collaborate with the Jabatan Kemajuan Orang Asli. Okay, the Orang Asli, the Indigenous People Development Division Department. Okay, so we work closely with them in order to help the Orang Asli disabled children and the indigenous people. They are what do you call it? They are what do you call disadvantaged, right? Because they are orang asli, they're indigenous people, and also if they have a disability, they are also second. There's a second discrimination also against them. So we try to help them in terms of improving their academic performance in schools. So tutorship. So we planning to have help sessions for them. In fact, at first we offered to the disabled children only, but then when the parents got to know, they also requested us to offer to the non-disabled children who are taking examinations for SPM. So we have extended it to their children as well. So, but unfortunately, the MCO is in place, so we are not able to have that that those classes yet. But inshallah, we will resume once the MCO is over. Inshallah.
Inshallah. So, and for our last question is what do you think as a student like us, what can we do like help the people with the disabilities?
There's a lot that you can do. Just now I mentioned, right, the institutional barrier that we need to break, right? So one of the major initiative that the DSU has to do is actually we need to undertake what we call mindset transformation program. We want to create a lot of awareness and empathy, all right, among the students. Empathy means you try to envision yourself in that person's situation. So you try to envision yourself as a disabled person. What would the person feel if it is given if they are in certain situation. So you try to imagine how they feel, how they experience and so on. So that's empathy, right? Putting yourself in their shoes. Okay, and we want to create a lot of compassion and humanitarian values also among students. So students can become volunteers, right? So DSU have got a few volunteer groups. We have the main one, which is the volunteers who actually assist DSU, as well as our club. We have a club of students with disabilities. this club was comprised with student with disabilities as well as the volunteers, student volunteers. Okay, so that they can have that integration, the inclusion, and they can help each other, right? And these volunteers are very active in helping the students. We can just call them, if our students have problems, even in the middle of the night, they can come, and assist. Or student get stranded somewhere, they can help and assist. Very, very helpful students. We also have special buddies. Special buddies are the buddies that we assign to specific students who need additional assistance, like students with autism, right? Students with who's blind, students with low vision and so on, vision impairment. So we assign special buddies. Okay, special buddies also are very helpful, all right, in helping our students. And then we also have other initiatives. Later we are going to come up with another group of students, okay, buddies, accessibility buddies, okay, to help us identify which are the places which, sometimes the ramps are broken and so on, but sometimes what we can do is that students can also help, maybe we can have projects like, if we talk about small ramps, which are actually very easy to make, ramps which are to make the rooms accessible, sometimes they're just small ramps that we need to do. And if, let's say, we can buy the materials and the students can help build the ramps for us, and maybe KAED students can help design, that would be very, very nice, isn't it? And we can actually also cut costs and make the campus more accessible. For communication students like you, so you need to break the information barrier, right? So, make sure that our, materials are, can be accessible, to those who are blind, for instance. Posters need to be accompanied by text, so that they can read what's in the poster, because they wouldn't know what's in the poster because they cannot see, right? So you need to be accompanied by text so that their screen reader can read, what's in the poster. It's things like that, right? And of course, you can help with the crowdfunding if you can. And of course, your research, your FYP, final year project, maybe you can come up with projects to how to help person with disabilities, to overcome their issues, their daily issues and so on. There are plenty of things to do, inshallah. Okay? Yeah. And I forgot one more thing. Very, very important. If the students, existing students clubs can also collaborate with IMEC, our students club, our students with disabilities, so that we can have a better inclusion and can make all your activities accessible and can invite them to join in. I think that will be very helpful in terms of, in having that social inclusion, which is very, very important for everybody to have. Yeah.
Okay, thank you, Madam, for your sharing your ideas. So let me know a bit more. And now I think we can move to our next session, which is question and answering session. So if you have any question, you just open your mic to us, or you can share it in the chat box.
May I?
Yes. Yeah. Yes.
Assalamualaikum, Prof. Zita, how are you, sir? Hi, madam.
Alhamdulillah, thank you.
Madam, I am a research student, PhD student from Kuliah of ICT.
MashaAllah, okay.
And I'm working with my research is about the learning disability among children with ASD.
Okay.
So my question was about, because I'm in the process of data collection stage. So I was wondering to ask you that whether the Department of Disability within UIA facilitate researchers to reach out to people for completion of research, because my target is special education teachers.
Mm-hmm.
And I am in the process of data collection from past 9 months, and I haven't reached the target yet.
Mm-hmm.
So is there any facility from your department to assist researchers who are working on disabilities or inclusion or learning disabilities or whatever, that they can, with the help of the department or the university itself, we can reach out to people within Malaysia? Because my scope is specifically Malaysian teachers and adoption of technology for learning among the ASD learners. So that's what I wanted to ask you.
Right,
Thank you.
Okay, yeah, we do assist, right? Where we can, we do assist. We have researchers, sometimes they want to do surveys for our students, right? For students become respondents. So we do allow that as well, but they will have to sign a certain document. But we do also assist other researchers who need assistance. If you can contact me directly after this, we can
Sure, ma'am. Sure. I would write you an email and regarding that.
Yes.
If I can have your okay, I'll search for your name and then I'll get your email.
It's very easy. It's just Rosita Anuza IPA. Okay, at IIEM. Okay.
All right. I'll note it down. Thank you very much.
Okay.
Thank you for your sharing, inshallah.
Okay.
Barakallah fi.
Yeah, thank you.
Okay, do you guys have any other questions that you may ask?
Our audience can send your question in chat box also. If you have any question want to ask our Dr. Rosita. So, Madam, I have a question. Can I ask?
Sure.
Yeah. So, because I want to ask, does your organization have any future project or planning to cooperate with partner for the persons with a disability?
To cooperate with who? Is it?
With partner, your partner.
Oh, okay. We have many partners already. Okay, but yes, we do plan to have additional partners. Okay, because we have big plans in the pipeline. Dr. Aida would know about it. Okay, because in the flagship we also have a component on OKU Sejahtera where we would like to have our sort of a rehab center. Okay, on campus because we find that our students with disabilities, a lot of them are having health issues. Okay, and sometimes it's very difficult for them to go to hospitals, to do their physiotherapies and other therapies. And our special parents also have their children with special needs, right? So if we do have a rehab center on campus, it will cut down a lot of time for everybody, and inshallah everybody will become, it's easier for them to get the necessary treatments or therapies that will make them healthier. And when they are healthier, it's much easier for them to continue their studies. We have many cases whereby a lot of students have got health issues, because of lack of physical maintenance. Yeah, because it's very difficult for them to go out. It takes time and so on. And sometimes at government hospitals, even the appointments are very, very, you cannot get frequent appointments. Okay, so if you have it on campus, hopefully, inshallah, we will try to assure the well-being, the physical well-being. And when we talk about the well-being of IIU seek to produce balanced graduates, isn't it? Balanced students, balanced individuals. We talk about balance and sejahtera. You have to be balanced. You have to ensure the well-being in all areas: physical well-being, intellectual well-being, spiritual, emotional, social well-being. All the well-beings we need to take care of, right? So as of now, even the sports center is not really accessible, and they cannot really do any sports, right? So I think there's a lot of things that we need to do, right? And a lot of partnerships that we can also do in order to implement our initiatives, inshallah. You do have contacts, can let us know. Maybe from China.
Okay, inshallah, if I have any idea, contact. So thank you, madam, for your sharing. It's very interesting planning for your future project. So I think it's time to do the conclusion. So it's my friend will do the conclusion.
Okay. Actually, I have a small question, but I think I will ask you later, maybe in personal, because I'm really interested in the disability unit. Because I want to try my best to help other people.
Alhamdulillah, that's good. We have students as well. We have students doing internship at DSU as well.
Oh, really? Hope we can go back to Malaysia early so that I can try to volunteer
at home.
Okay, so right now we will stop here, and for my conclusion is to establish a good partnership or to get cooperation from other developing countries. It is the responsibility of the government also and the other organization. But as for us, we also can do some contribution too, even though not much, but we can try our best to help people with abilities. So through our webinars, we hope that everyone here will promote the spirit of volunteerism, offer help the disadvantaged groups or disability people in need of help. To convey the symbol of love, let them feel the care of the society and make them look at life with more healthy and positive attitudes, and face the setback of life bravely. And okay, so we conclude. If you guys don't have any question, we will end of our webinars. Thank you for Dr. Rosita to be our honorable guest and sharing your wonderful experience. And thanks to everyone in here that joined us for today. And right now we conclude our webinar with the speaker Farah and also all ours. And thank you, madam, and thank you for
Thank you very
everyone.
much.
Thank you, madam.
Thank you.
Thank you everyone to
Bye.
join our webinar.
Assalamualaikum.
Waalaikumsalam.
Thank you. Assalamualaikum.
Salam. You want to ask me a question, is it? Bye.
Yes, because I would like to know because I didn't have time to know about the disability union. So if like us we want to join the disability union, what should we prepare or what should we do?
Give us your name. Give us your name. Give us your name.
Really? I want to join also.
You can give
I
us
want to
your
join,
name.
but like we are in China right now. If UIA, I will straight away go and to get it.
Yeah, so once you come back to UIA, you can come and join our office. We have Datuk Yusri here. Okay, Datuk Yusri.
The more the merrier.
The more the merrier. Datuk Yusri just joined. We just ended.
Yeah.
Datuk Yusri is one of our advisors in DSU. A very important advisor. This is also another partnership. Actually, we have 3 advisors. Datuk Yusri. From he's a former military general, right, and strategist, and also a specialist in leadership training and transformational change. So he has his own training and leadership company. All right, so we do a lot of trainings with Datuk Yusri, and normally he just trains free of charge. That's the way free of charge. Okay. That's the best part. Thank you, Dato', for coming.
Yeah. Understand.
Yeah, we also have 2 more, Madam Martinelli, okay, and also Madam Noraini. Madam Martinelli is the former director of SENSA, the unit for community engagement, and Madam Noraini is a former director of counseling unit. Yeah, so these are very important.
Prof, sorry, the Yingzi. Yingzi from where? Which country? How you pronounce Yingzi?
China.
Oh, which part of China?
I'm from Inner Mongolia, but right now I'm staying in Yunnan.
Oh, in the Mongolia. Okay.
Yeah.
I was in Guafang Daxie. I was in Guafang Daxie for 1 year. Guafang Daxie.
Oh, okay. I know, but I didn't because I was small. I already come out from Inner Mongolia because my parents works in Yunnan. So
I was in National Defense University for 1 year in Beijing.
Wow.
2013, 2014.
Military general.
Yeah.
Oh, already long time.
Yeah.
Very interesting.
Yeah, I hope your what they call it, your intention to join, to contribute, to participate with Disability Services Unit will be materialized, and hopefully this COVID-19 will go away immediately or in the near future. In fact, if you come back to UIA, you can join Professor Rosita engaging the what they call it, the indigenous people by
Yes.
giving tuition to them.
Mm.
Something which is new to you and to other people, other students.
Yes. Very, very
Yes,
Thank you, sir.
important.
Inshallah.
Yeah,
inshallah, we do
Inshallah.
our best.
So I think your two names, right? Any other volunteers?
register.
Register.
I will try to ask my
Okay.
friend.
Alhamdulillah, that's very good. We also train our volunteers, so that they are able to help our blind students, and even if outside, we have had students whereby when they're outside, they are able to help the disabled community as well, Then they find that it's very fulfilling. They have learned
Yes.
things, and they can also apply and help other people outside, So I think it'll be good for you and also for your career later on. When you have empathy towards other people, you have compassion, you have towards other people. I think you have a good heart. So that will actually carry you through a lot of success in the future, inshallah.
Yeah, the Inner Mongolia is the land of warrior, Professor.
Wow, really?
Yeah, the land of, I mean, the land of warrior.
Even the ladies.
Am I right, Lindsay?
Yeah, yes.
Yeah.
I watch the Chinese series sometimes. The olden series. I like to watch.
Yeah, the Inner Mongolia.
Mongolia.
Where are you?
Maybe you should go there and visit, Datuk.
Yeah, you can. And I will bring you to the place that is very interesting.
That's
Open country.
I've never
Nice
been to China.
Come to China.
Yeah, for the
come
host.
to Yunnan.
Oh,
You can
Yunnan.
Yeah,
Okay.
Yunnan.
Oh, you went from Yunnan.
Yeah, I'm from Yunnan, and Yingzhi is in Yunnan also now.
Oh, okay.
Right now, I'm
Okay,
even.
that's good.
Yeah.
I see. That's good. Okay, thank you very much. See you then. Assalamualaikum warahmatullahi
Thank
wabarakatuh.
you, sir. See you next
Salam.
time.
Thank you, sir.
Thank you,
You're very
madam.
fortunate that Dr. Yusri has joined. He has never joined the sessions.
Very, very good that you
Very supportive, very
energetic.
supportive. Alhamdulillah.
Yes.
So inshallah. So that's a real military general that you're talking to. Okay. So inshallah.
Okay.
So you can give your details, right? To me, you can just email to me or just WhatsApp to me. Then we can
Sure.
our list of volunteers, inshallah.
Inshallah.
So both of you are back in your countries, right?
Yeah.
Yes.
Yeah.
Well, I already like 8 months in China. I'm very miss Malaysia.
Yeah, but China is free of COVID already.
Yeah.
Alhamdulillah.
Alhamdulillah.
But now Malaysia is actually going through a bad time. It's really bad, the situation now. There are many lecturers who are positive COVID now. So even my neighbor at the office also just got news that he got COVID, one family. So I just make dua that everybody gets well, and hopefully all this with the vaccination, hopefully it will go down quickly, inshallah.
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 Together.
Yeah, we pray together, inshallah.
Yes. Okay, thank you, madam.
Thank you so much. Okay, all right.
Thank you,
Okay.
madam.
Thank you.
Okay, thank you for
Next
having
time.
me. Okay, Assalamualaikum.
Waalaikumsalam.
Assalamualaikum, madam.
Waalaikumsalam.